Most women don't want to talk about it, but more than 1 in 3 women above 50 has it. What am I talking about? Urine leakage.
Dr. Chong, what is urinary incontinence?
Urinary incontinence is simply urine leakage. And a normal person will not leak urine. So any urine leakage is abnormal till proven otherwise.
Is there various kind of urine leakage?
The most common type will be stress urinary incontinence. When a person cough, sneeze, run, jump, they leak urine. The next common type is that of overactive bladder or oversensitive bladder. Most people can hold urine about 400 cc, but for people overactive bladder, the bladder tends to contract when you have urine of about 150, maybe 200. Third most common type will be that of overflow incontinence. The bladder has so much urine and you have a problem with passing out, so it's so loaded that urine leaked out.
How prevalent is urine leakage among women?
In my study, the general leakage rate, the prevalence is about 15 to 20%. Once it's above 50, it's in a very shocking 35.8%.
Okay, so what are the treatments for urine leakage?
When it's mild, we still do the Kegels or pelvic floor exercise to tighten up the pelvic floor muscles.
Right, okay.
For moderate to severe, we do surgery for the patient, will be a better result. It's a 10-minute surgery, putting a sling under the bladder, no cuts on top, with a success rate of up to 95%. For urge incontinence, urgency cannot hold urine and rushing the toilet and leaking out. The mainstay is oral medication.
Okay.
So these medications you take to control the squeezing of this contraction of the bladder, so you can hold more urine, you don't have to go so often.
Would you also say that to choose and use a purpose-made product like TENA would be helpful to manage the condition as well?
Certainly, all this incontinence pad is very important. And it's very important you choose a good one because it needs to be absorbent enough. Otherwise, there's leakage in around the vulvar, vagina area. That's increase the risk of urinary tract infection and vagina infection.
Anything we'd like to say for sufferers who are going through some tough time with urine leakage?
Urine leakage is very common. It can be easily treated with minimal pain, minimal complication, and the success rate very, very high. So don't keep this to yourself. Women can be empowered to be in the best of their health.